Hi, good afternoon. Today I'll provide a brief update on the latest numbers coming from DHS, a little bit about what our hospitals are experiencing, an update on community testing, and the latest on vaccinating our county's healthcare workers within DHS. Overall, we continue, as you know, to see signs of this deadly surge continuing, even though the numbers of hospitalized patients across the county have stabilized for now. I'm very grateful, as always, to our dedicated frontline healthcare workers who have continued every day to rise to the occasion, and they show up day in and day out to care for the sick people who need acute level care services and life-saving care in our county's hospitals. As of today, as Dr. Frere just reported, the hospitalizations are relatively constant across the county at just shy of 8,000. Across all of the hospitals in the county, there are being reported 650 available beds and 46 available ICU beds. And if you'll recall, these total numbers represent all beds, both adult specialty care beds and pediatrics beds, that are being reported by the hospitals on a daily basis as what they have immediately available to take a patient. DHS, for its 4 public hospitals, has 554 COVID-positive patients as of this morning, and that includes 143 of those who are receiving ICU-level care. 53% of all DHS inpatients and 75% of all inpatients in the intensive care units within DHS hospitals have COVID, and these numbers are very similar to what's experienced across private hospitals as well. Just as all hospitals, we still have patients who are being boarded in the emergency departments, and we still have our clinical care teams caring for more patients than what they would under normal circumstances. Patient care is being supported by a very large number of redeployments of nursing staff and other staff from outpatient facilities, as well as support from state contracts and registry. We're also grateful to the Department of Defense and the Disaster Medical Assistance teams, the DMAT teams, who have arrived within Los Angeles County. They joined, those 2 DoD teams have joined their teams at Harbor UCLA Medical Center and LACUSC Medical Center to help with staffing. They're typically 20-person teams, and they have a variety of staffing support and clinicians there, including combat medics, nurses, and respiratory therapists. There's also teams being deployed at least 5 private hospitals as well. We also appreciate the involvement from the California Department of Public Health for embedding here with our EMS agency, which serves as the MOAC in Los Angeles County. They are diving in to better understand and be able to address the challenges that hospitals are facing, both in terms of troubleshooting infrastructure issues like what's been reported on with oxygen supply, trying to manage lateral transfers or troubleshooting issues with transfers to lower levels of care so that our acute care resources can remain available for those who require that acute level of care. There are also troubleshooting issues with durable medical equipment as needed, and we're very grateful for their on-the-ground involvement and assistance. Despite the support that all of this provides, there remains staffing shortages countywide in all hospitals at healthcare facilities, and we are still very much in the midst of this deadly surge. We're watching the data very carefully over the next couple of days, as this is the time when we would anticipate beginning to see the surge in patients from the recent Christmas and New Year's holidays. Because of this, I continue to urge everybody to stay at home as much as possible and to continue to follow all of the guidance from the Department of Public Health about how you can keep yourself safe, your loved ones safe, and prevent transmission of this virus within the community. That includes staying at home, washing your hands, wearing your mask, avoiding gatherings, and altogether trying to avoid interactions with those outside of your household. We want to make sure that whether you have COVID or need some other form of care from a heart attack, a stroke, a traumatic injury, a car accident, that the life-saving services of hospitals are there for you if you need them. Shifting now to testing. As you know, the city announced last night that Dodger Stadium testing site as well as the VA testing site will cease testing operations as of today in order to transition Dodger Stadium to become a vaccination site for COVID. We are very grateful for the support that the city has provided and their leadership for providing testing access for all those across this county and city, having administered over 1 million COVID tests to date. In response to the state's announcement, the Department of Health Services, as the lead for community testing in the county, is exploring opportunities in continued conversations with the city to fill some of the testing gaps that will be created by these 2 site closures. There is availability this week for those in need of a test, but testing demand remains very high across all of the sites, city, state, and county, given the ongoing surge. I continue to remind everyone that if you're experiencing symptoms that might be consistent with COVID, or if you have a known exposure to someone with COVID-19, please first call your healthcare provider or your plan to discuss whether or not you need a test and to try to be connected with resources within the established healthcare system. If you don't have a provider, you can find access to the test by the county's COVID-19 testing site or by calling 211 to get assistance. If you aren't able to immediately get an appointment for a test through the community testing sites or through your provider or plan, then please continue to self-isolate if you have exposure or symptoms that lead you to believe you might have COVID. In addition, following the alert from the FDA about the risk of false negative results, DHS has made the decision to stop all use of the curative test. Curative tests were only used at county testing sites for a period of approximately 3 weeks, from mid-December to early January, and they accounted for a very small percent, about 10%, of the tests used at those county-supported testing sites during those 3 weeks. Curative tests we are making this change as a precaution given the FDA's warning, and will replace the curative tests with the test provided by Fulgent Genetics, which is the lab vendor that we use for the vast majority of the county-operated testing sites. Regardless of which vendor any site uses, please realize that all PCR tests, and really all COVID tests, have a risk of false negatives. And individuals should complete their quarantine if they have an exposure, or if they have an exposure to someone with COVID, even in the setting of a negative test. A negative test should still never be used as permission to stop quarantining. Finally, a brief update on vaccination, and then we'll take questions. DHS workers are continuing to receive now their 2nd round doses of the COVID vaccine this week. As of Friday, 3,000 DHS workers had received their 2nd dose of the Pfizer vaccine, and about 14,000 had received their 1st dose. More vaccine clinics are underway today and will continue over the next several weeks. Because it can take weeks for the vaccination to provide the appropriate and full immune protection, it remains important that people, even if they've received a vaccine, that they keep doing what's needed to reduce transmission, to protect themselves in wearing a mask, but also because you can still be infectious to others even if you've received that vaccine, to reduce transmission to others. So please, if you have received a vaccine, we're very glad that you've received that and that you have that opportunity for protection, but you still need to wear a mask and you still need to do all those basic public health practices to avoid spreading the virus to those around you. I urge and caution everyone within the community to keep up those practices and to not get tired. I know it's been a long road, but we're getting close, and we still need everyone to remain vigilant with the practices for the sake of the health of all of those around us.
For more information, go to the website on your screen.